Who wants better healthcare for older adults? The quick answer is that everyone does. Patients, providers, and healthcare institutions want the best for the aging population. But the question is, if you were to redesign clinical operations to maximally optimize quality while lowering costs for older adults, what would that look like? This presentation provides a quick overview of why the age-friendly healthcare framework will streamline your assessment of Medicare patients while improving action plans to optimize their healthcare. You might wonder whether we actually need to do anything differently than usual care for older adults. Based on numerous reports, the answer is emphatically yes. We need to find ways to address the Alzheimer's epidemic, and it doesn't help when doctors regularly fail to recognize early cognitive changes in their patients. The fall rate in the United States continues to skyrocket despite our business as usual model. Over 50% of older adults have too many medications, many which are unsafe and can cause delirium and falls. From a financial perspective, health systems need to understand that patients with any of the geriatric 3Ds, such as dementia, depression, or delirium, cost twice as much as people without those conditions. Geriatric experts in the field have thought about these problems and how business as usual is not providing solutions. Thus, they conceptualized a new framework for healthcare, called age-friendly healthcare. Through this framework, quality leaders practice evidence-based geriatrics, optimize healthcare for older adults, and reduce healthcare costs while improving its quality. People often ask, what is evidence-based geriatrics? Geriatrics is a medical discipline that does research on the best models of healthcare for older adults that produce the best outcomes. For example, we know that comprehensive geriatric assessment improves cognitive, physical, and psychosocial function of older adults who are medically complex. Additionally, geriatric experts devised the geriatric 4Ms to provide a streamlined way of thinking about each older adult patient. Geriatric practice focuses on the 4Ms of what matters most to patients, identification of harmful or excessive medications, issues that affect the mind, and mobility concerns, including falls. A two-step process helps us implement the age-friendly framework. Firstly, we need to educate our healthcare workforce on evidence-based geriatrics. Secondly, we need to revise and augment what we are doing already to integrate the geriatric 4Ms into routine clinical care. This process is not a heavy lift and mostly entails reorganization of information already being gathered by our providers. What are some of the results that we can expect from implementing age-friendly healthcare? Age-friendly provides a return on investment in all clinical settings. Hospital lengths of stay and recidivism are substantially reduced for the Medicare population, and it reduces feudal healthcare associated with end of life. Age-friendly generates improved safety by reducing fall rates and the use of unsafe medications. Health systems who adopted age-friendly report an uptick in patient and family satisfaction. Less well documented, but anecdotally reported, is the impact age-friendly has on the healthcare workforce when they gain new knowledge and skills that helps them deal with the often complex issues with aging patients. Age-friendly can be practiced across the continuum of healthcare. By doing so, transitions of care can be enhanced and consistent with what matters most to older patients. Age-friendly health systems is a national program with traction from multiple organizations, including the American Hospital Association, the Institute for Healthcare Improvement, the Veterans Administration, Medicare, Health Research and Services Administration, the National Rural Health Association, and the Joint Commission. Age-friendly helps fill the gap that currently exists in geriatric expertise throughout the country, and it helps assure the practice of evidence-based geriatrics. Finally, age-friendly improves clinical outcomes while reducing overall costs. Thank you for listening to this age-friendly presentation. You have an opportunity to enroll in the age-friendly program through the IHI website portal. Our faculty and staff at the Dakota Geriatrics program are available to assist you in transforming your operations into age-friendly healthcare. You are invited to contact us for additional information.